Welcome back. June is designated as Men's Health Month, and millions of men are reminded to visit their doctors for a regular checkup. So let's get right to it. Joining us this morning to discuss some of the top health risks for men and to set the record straight on some common myths relating to men's health is Dr. William Hudson with Touro Family Medicine. Good morning.
Good morning. Glad to be here.
So nice to have you on.
Thanks very much for having me.
Now, if folks want to come find you, we should say you're not at the main campus. You're in Mid-City,
In Mid-City
actually.
on 4000 Benville.
Okay, and what's the name of your practice? It's a little bit different.
Crescent City Physicians.
Okay, perfect. Well, we'll have to come seek you out. Let's talk about men's health here. What are some of the biggest risks that guys need to worry about?
Well, there are really 5 key issues. The first is heart disease, stroke, suicide and depression, lung cancer, and prostate cancer.
Okay.
As far as heart disease, it's almost twice as many males die of conditions that affect the cardiovascular system than females. With stroke, the incidence is 1.25 times that of females. With suicide and depression, men are 4 times more likely to commit suicide. Lung cancer is the leading cause of cancer in both men and women, and it causes claims more lives than prostate, colon, and breast cancer combined.
Wow.
And prostate cancer is the most common cancer that occurs in men. Most are treatable cases. It's the second leading type of cancer death in men after lung cancer.
Wow. Some of those are a little bit surprising. Heart disease obviously is such a huge killer of Americans, men and women, but it really is so much higher for men. Why do you think that is?
It has to do with actually hormones. One thing, estrogen is sort of protective for women, and once they go through menopause, then the chances of developing, they become more, the risk factors correlate to men.
Interesting. Diet as well, maybe?
Diets, particularly maybe what region that you're in too. So certainly a high-fat diet contributes.
Yeah. We're in trouble down here in New Orleans, huh?
This is true.
All right. So as far as visiting the doctor, it is Men's Health Month. The goal is to get people out there going to see their doctor for that regular checkup. So how often should guys be going in? Well,
probably at least once a year if you're healthy. Even if you're feeling fine, it's very important to still see your healthcare provider and get your checkups. The only way to find out whether you have hypertension is to have it checked regularly. High blood sugars and cholesterol may also not have any symptoms, particularly in the early stages of the disease. So it's really important to have your blood pressure checked every year. If you're age 35 or older, then I would suggest checking your cholesterol every 5 years. After age 50, then you should start having it done every year. If you're age 45 or older, then it's important to check for diabetes every 3 years. And if you're age 50 or older and a male, you really need to discuss cancer screening, prostate cancer screening with your healthcare provider, and inquire about the prostate antigen. And I recommend annual checks.
Okay, and if someone is making an appointment, obviously it's always good if you have little thoughts, questions, concerns, write them down, right? Because
absolutely. So that's true. And usually it's important. If you want to that's your time, and that's the time that you really wanted to get all the answers that you need.
Yeah, and you mentioned a couple of the things as far as getting when to get your cholesterol checked, your blood pressure, that type of thing. Do you need to ask that stuff in advance when you make an appointment? Is that something you can ask the doctor when you're there?
You can ask the doctor while you're there. Usually if I'm seeing someone, I usually look at the age and I've already sort of have everything what they need for what appropriate age. So risk reduction.
Yeah, but the key is to go in and do it. Men, it just seems like, are so very reluctant to see their doctors. Why do you think that is?
Well, men overall tend to postpone things. They really don't. They tend to neglect themselves unless there's a persistent problem.
Yeah.
So.
Okay. Well, so what can guys do to improve their health this month?
Well, you can remember to stay on top of your game. So that means that go and getting a regular physical. Certain diseases and conditions may not have symptoms, so checkups are very important to identify issues early or before they become really a problem. It's important to get sufficient sleep, anywhere between 7 to 9 hours per night. If you're a smoker, I strongly suggest that you stop. This is going to lower your incidence of risk for cancer. You want to move more, at least at the minimum of 2.5 hours of moderate intensity aerobic activity is needed per week to keep one healthy. You want to sort of control your stress. That's very important as well. And also be mindful of your food intake. You want to limit foods and drinks that are high in calories, sugar, fats, salt, and alcohol.
Okay, that's good advice, I think, for both men and women, a lot of what you listed off there. Okay, so we have some of our myths that are associated with men's health. So I'll start with the first one here. Men are more likely to get prostate cancer than any other cancer. Is that fact or fiction?
That's very true. According to the CDC, prostate cancer is the most common cancer in all men. About 1 in 6 men will develop the disease during their lifetime, and about 3% will actually pass or die from the disease.
Wow.
So it's important to remember that most prostate cancers are treatable, they're slow growing, and if they're caught early, they can be treated.
And that's the case with almost anything. You
Absolutely.
have to catch it early. Early prevention is the key. Okay, our second myth, prostate cancer only affects older men. True or false?
That's false. Well, it's true that prostate cancer is more common with increasing age. All men of all ages should be vigilant about knowing their risk factors and also their symptoms, and talking with a physician about getting tested for the disease. The American Urological Association recommends that men ages 40 and older talk with their doctor about prostate cancer testing with a prostate-specific antigen test and a simple physical exam.
Okay, real quickly before we go, osteoporosis is a women's condition, true or false?
That's false. While osteoporosis is generally thought of and discussed as a disease that affects postmenopausal women, there are a substantial number of men that are affected by it.
Okay, well, thank you so much. Great information here. We're all out of time, but we appreciate you coming on.
Thanks very much for having me.
And if you want more info regarding Men's Health Month and the top men's health issues and those common myths, you can visit WGNO.com and click on the 411.